Good afternoon. I guess, have 91 of you on this webinar. Thank you for joining. I know everyone seems to be a little nervous about this pandemic that we're experiencing. We are handling this crisis with action and not with fear. We comb through the conflicting stories, rumors, and misinformation and can just continuously update our strategy in a clearly focused and positive manner. This is Ed Kalous, the CEO and founder of MEDI Weight Loss. We will provide current information on a weekly basis. Our town hall meetings will be scheduled for every Wednesday at 2 p.m. We will send a broadcast or a MEDI alert out on that. Today, we will review our actions to date, including an update to the government stimulus package. The revised protocols have been released through MEDI Alert and are now on Advantage. You can also contact your regional franchise consultant or medical affairs department. Our task force on telemedicine is progressing rapidly with even more help from our providers. We've had a lengthy discussion yesterday with a telemedicine attorney who is an expert from New York, and he will be on later. Our franchise location in Massachusetts has booked over 200 patients next week on telemedicine. Pages are sticking together, I'm sorry. Dr. Sam Miguel will provide a weekly medical update. Finally, we will take your questions and answers at the end of this call and at every town hall. Our franchises are independently owned and operated. We do not tell you what to do about your business. We suggest the revised protocol and telemedicine platform as soon as we solidify things. Some locations, as allowed by state law, are already doing telemedicine. Our signature patient website is extremely important for our patients for exercise, nutrition, menus, recipes, journaling, and more. The signature patient website was designed to improve outcomes. This essential tool is so informative and may find more popularity by default. Please mention this to every encounter. The public cart can help you with your revenue. Refer your patients to the public cart. We are experiencing overwhelming orders currently. We will observe and comply with all federal and state laws regarding protocol and telemedicine. Please also seek counsel on these matters with your own healthcare provider or attorney. Today, Andrew Cox will cover the highlights about government stimulus. Andrew?
Thanks, Ed. Brooks and I are going to stay on top of the stimulus package for obviously individuals as well as disaster funds and SBA for you as the franchisees. Our ownership team is meeting daily at 9 a.m. every day, and we'll all manage to do this together. I'll update you this week, and Brooks will update you next week. It changes daily, as we all know. For those of you who know or don't know, there is a stimulus package. It's actually a $1 trillion stimulus package. It's actually changed from yesterday to today. It's not yet passed. The Congress and the White House are negotiating on that. For employees, and something for you guys to know, there will be, as of right now, the details would be a $1,200 check going out to all individuals making $75,000 or less, and a smaller check going out to all individuals making $99,000 or less, as well as $500 for every child, for every family that makes $198,000 or less. If passed, those would come out approximately in 3 weeks. They're targeting by April 15th, and then again in 6 weeks if it's still a national emergency. It's a $500 billion in 2 batches, and we'll know more hopefully as soon as that passes. There's also an additional $300 billion for emergency fund for small businesses. As it relates to you, the franchisee, and in particular SBA, Brooks and I were just on an IFA call this morning, webinar, and we have more this afternoon, so we'll continue to keep you updated. But the SBA does have disaster funds that are currently passed. The amount of money does keep changing. Funds are for existing businesses to help them keep operational, to pay such things as payroll and fixed debts, accounts payable, etc. It's all through the SBA directly, so you can go through the SBA and check out their website. Everything is on their website. They've made it much faster and easier for the qualification processes, and obviously more legislation supporting SBA programs that are on the table. And the IFA is aggressively really an advocate for you and for all of us as franchisors and franchisees. And then last, just one quick point, as most of you probably know too, from a tax perspective, taxes were officially, the deadline was extended to July 15th. So all of you that do obviously we have quite some time. And then for those for employees that might be getting money back, they might want to go ahead and file as soon as possible to get those refunds. So more to come next week. Ed, I'll hand it back over to you.
Thank you, Andrew. Dr. San Miguel and Randy will now provide updates germane to their areas of specialty, including revised protocols in the marketing response and opportunities and actions that we are taking. Dr. San Miguel?
Thank you, Ed. And I wanted to thank everybody that was on the call. I know that everybody right now is very worried, not only about their health, but about their financial health as well. So it's really important about the health of their patients. So it's really important that you do access the resources that we have provided for you on Advantage. These were uploaded yesterday or the day before. In there, you're going to see the modified protocols that have been created for the COVID-19 pandemic. So I just wanted to quickly go through them so you know what's in them. The beginning part is just basic infection prevention measures that should have been occurring regardless, but they are being provided because they are extremely important in mitigating that potential risk of exposure at the clinic level. So they are the standard precautions recommended by the CDC for infection prevention and patient safety, and they're extremely important, if not more important now. We do recommend that a safety officer be assigned and responsible for knowing and overseeing all these requirements. And that safety officer should be the one that's training and assigning these tasks to specific staff. Another recommendation is to be posting information about COVID-19 in your location for education of staff and patients as well. And we have uploaded a few of those on Advantage as well that we recommend posting both for staff and patients. Hand hygiene, like you already know, is the most important measure to avoid the transmission of COVID-19 and other harmful genes. So it's really important that you go over those protocols and what's expected in the healthcare scenario. About the personal protective equipment, usually in our line of business at the location, the most important is the gloves. Please remember that this is not only for the protection of yourself, but also to the patient. So don't be reusing gloves and touching multiple surfaces with those gloves and assuming that they are just for the protection of the healthcare provider. Please know that they're also for the protection of the patient. So be very vigilant and cautious when using those gloves and make sure they're not providing a false sense of security. Injection safety is also spoken about in the protocols, as well as how to do a complete thorough environmental cleaning of your location. Remember that environmental cleaning is basically an extension of the hand hygiene, but to other surfaces. So you want to make sure to pay specific attention to those frequently touched surfaces and be disinfecting regularly. Things like the bathrooms, medical devices, blood pressure cuffs, things we don't think about on a daily basis before are extremely important right now. Stethoscopes, the doorknobs, tables, and chairs, the water coolers, and especially our personal cell phones. We're disinfecting everything, and then we go again and touch our cell phones, our personal cell phones. And I think that's the number one area where those germs can be in and can be passed back to other people. Excuse me. So make sure you go over that area of the protocols. And then I go into role-specific recommendations that need to be followed, especially for us. It's extremely important that the front staff also understand that they, even though they don't have direct contact doing physical exams and whatnot with patients, they are in very close proximity to patients, especially during check-in. So you want to make sure you limit that exposure. Try checking in the patients yourself without having them to sign in or having to touch any pads. Make sure you're disinfecting laptops, screens, and desktops regularly. And most importantly, try to avoid and do not sample products that are not individually wrapped. So I know that before we used to sample different things like the crisps and the zippers and things like that in small containers. Please avoid doing that, as a lot of the virus can remain in the air, live in the air for hours, as well as on surfaces for up to 3 days. For the medical assistants, just make sure you continue to follow the strict OSHA protocols for our regular system standards. Make sure you're wiping down the blood pressure cuffs, the tubing, and the manometer in between every single patient with alcohol-based disinfecting wipes. Please remember to also be disinfecting your stethoscope between every patient. I always recommend to do this in front of the patient. Not only does it remind you to do it before and after the patient, but it gives the patient a sense of security that these measures are being taken in the location. So really important, when you're weighing in those patients on the tomato scale, make sure you wipe down the touch screen as well as the foot pad. And we are suspending the level and the review temporarily. We will be coming out with enhanced protocols for those to be able to restart those in the near future. But for now, we think it is better to temporarily suspend the use of those. And the blood draws, those of you who do blood draws, please make sure that you just continue to follow strict social protocols and make sure you're wearing your gloves as opposed to and any other type of barrier. After that, the EKG machine as well as the injection, make sure you're following that. And office managers, I did put some resources there for you to go to so you can educate your staff and the patients as well. After that, Dr. Goodman and myself came up with potential exposures and what to do at clinic level, so make sure you go over those. Make sure you know that you should be asking 3 questions when the patients are checking in to know what the potential exposure has been of that patient. So those are extremely important. And we also went through post-exposure clinic procedures. So what to do if you or anybody of your staff thinks that they may have been exposed or may have the infection. So please make sure that you access these enhanced protocols in advantage. And as always, you're welcome to email medical affairs with any questions regarding this, and we'll be in touch within 24 hours.
Thank you, Dr. San Miguel. Randy, I know your marketing department is releasing timely messages through social media and all other media. Please describe your plans as they are rolling out.
Sure. Well, I first want to take an opportunity to remind everyone to take heart with MEDI News. We're posting all of our system-wide messages on MEDI News. And you can actually subscribe to it by email. So you just click on Advantage, go to the news section, click on channels, and then you can check a little box for the channels that you'd like to be sent to your email and hit subscribe. So that is very important. If you're not checking Advantage often, you might want to go ahead and do that so you don't miss an important message or an announcement about an upcoming webinar or anything else. So in this recent MEDI News post, we did announce some of the things that the marketing department is doing for all locations. We are actually going to be sending out an email to every single patient that allows email every single week. So the next one will be coming up on Tuesday. The initial patient email went out on Monday as planned. We are going to give you the opportunity to opt out of that email. So please just look again on MEDI News. Later today, it'll tell you what the email will say, and you need to opt out by Monday at noon in order to stop that message from going out to your patient. Collecting emails, of course, is very important. So if the patient does not have an email address, or the email address is not correct, they're not going to receive that email message. It's very important to maintain communication with the patients in the community during this time. So that's why the marketing department is going ahead and doing an email for everyone. In addition to the email, we'll have social media posts go up on your Facebook pages once a week. In addition to that, we'll have tons of content available on MEDI Social Hub and Advantage that has timely messages. So those types of messages might be how to exercise at home, how to do a home exercise, how to maintain your healthy lifestyle at home, immune boosting tips. So anything that your patients might be looking for at home.
Thank you, Randy. Derek Kalust will now provide an update on telemedicine and the task force progress today. Derek?
I know everybody's, ready for words on telemedicine. As I sit here and address you, I think about it almost like when I had my son. It's like the most challenging and rewarding thing all wrapped up in one. I think the telemedicine, if you look into our history with it, in order to understand where we are now, that history is important. Aspects, which I'm really not here to address today. You can imagine, taking somebody's BMI, EKG, urinalysis, blood work, just alone on the clinical analysis aspects of what we do on a daily basis. You can imagine why our company hasn't dove into telemedicine because of the controlled substances that we deal with on a daily basis, whether it's the first initial visit or a follow-up visit. The clinical aspects provide some type of challenge for telehealth. But I'm not here to address the clinical aspects. We have great people on our team, Stacy Heald and Gretchen and Dr. Guzman and John, that are going to address the clinical aspects and how we can get that done through telemedicine. What I'm looking at from our history is the legal restrictions. So from a legal standpoint, the restrictions on prescribing class 2 through class 4 controlled substances through the internet was a huge hurdle. The DEA said you couldn't do that unless you had some type of personal medical evaluation. Also, there is strong HIPAA restrictions on the tools that you could utilize. A lot of tools that are out there, like Facebook or telephone calls, might not rise to the level of the HIPAA protections that are required. And then, of course, every one of your states has different telehealth laws. And because of the fact that they're different, substantially different, it would be very difficult to do our particular program across the entire country through telehealth. Finally, insurance carrier reimbursements. If you're one of those non-cash clinics wouldn't have this problem, but the ones that are actually seeking reimbursement from insurance carriers, traditionally there's only minimal amounts of money for reimbursement available for these telehealth types of visits. So as you can imagine, when this pandemic hit last week, at least when I say last week, it might have been 2 weeks, but I think January is when they announced it. You can imagine that telehealth might not have been the first thing we were going to jump into. And it might not have been even an option for us because of all the restrictions in our history that I just went over. But since the Secretary of Health and Human Services on January 31st, 2020, announced a public health emergency with this pandemic, things have changed. And even recently, on March 16th, the DEA announced that it will allow prescriptions for class 2 to class 4 controlled substances without an in-person medical evaluation. So that's a huge, huge hurdle that has been lifted on us. The fact that the DEA will now allow over the internet these prescriptions. HIPAA restrictions. The Office of Civil Rights, OCR, now states that telehealth can be delivered through FaceTime, Facebook Messenger chat, Google, Hangouts, and Skype. There's a lot more tools that our physicians and medical staff have at their fingertips to provide a continuous care to their patients. So I want you to understand that in the last few weeks, major hurdles have changed from the DEA to HIPAA that are now allowing us to use telemedicine for continuance of care issues that we never had at our fingertips before. These new telehealth care options are definitely something that all of our franchisees are going to have to understand, look at, review, and consider. So now I'm excited to introduce somebody that I've met recently through one of our franchisee connections. His name is Justin Stone, and Justin has about a decade, as a chief legal officer for MEDI Live. MEDI Live is one of the largest telehealth care providers out there. He's a founding member, and I'm really excited about this, a founding member of Alliance for Connect with Care. They're the leading organization creating legal and regulatory environment for telehealth providers. So this guy's been doing this in his wheelhouse for many, many, many years, way before a pandemic ever hit us, okay? This is all he does every day. In fact, keep this in mind. Justin daily communicates with members of President Trump's task force on telehealth. Okay, so now what I'd like you to do, as a group, we're going to welcome Justin, and then I'd like Justin to give us a brief overview of two different areas that I addressed earlier. One, let's talk about how states are reacting to this pandemic regarding telehealth. What are they doing in this pandemic situation? Emergency actions that are being made to allow telemedicine and telehealth to occur. And then two, insurance carrier reactions to the pandemic. What did CMS do, and what is large carriers like Blue Cross Blue Shield doing in order to make this an option? So Randy, could you please open it up to Justin? Well, Justin, are you there?
I am here. Can everyone hear me all right?
Yes, we hear you loud and clear, Justin. Thank you for coming on.
Well, Ed, Derek, thank you for the opportunity to speak with everyone. First and foremost, hope everyone is staying safe amidst an unprecedented, chaotic event. As Derek said, my background over the last decade is in digital health and the regulatory environment. I'm proud to say that I've helped kind of craft the current state-based legislation that exists on the subject. But these are unprecedented times, and what I want to lead with is anything that I say on this call right now, the updates that are providing. This is such a fluid situation that these are changing hour by hour and day by day. With regard to the two areas that Derek asked me to cover, first and foremost, many state executive branches, the governors of many states, are passing emergency coronavirus executive orders with a large emphasis on freeing up access to clinical services to help, with social distancing and prevent the spread of the coronavirus. And with that comes a major emphasis on leveraging telecommunications technologies and telemedicine tools for the provision of healthcare services. What I want to emphasize is that there is a lot of misinformation out there and different people who are interpreting these things in different ways. It's very, very important for all franchisees to realize that these vary by state, and they vary in the limitations and the exceptions that are provided. So while one state may be more loose with their restrictions, their exceptions, or what is allowed than others, it varies and changes on a day-by-day basis. The main areas that they're loosening restrictions on focus on state licensure for physicians and focus on reimbursements. And as you see, a lot of states are advocating for what's known as payment parity, which is language that requires commercial insurers and state agency insurers like state Medicaid agencies to reimburse for healthcare services that are provided via telemedicine at the same level and at the same rate as if they would if it were done in an in-person visit. It's important to note that telemedicine has different meanings in different areas. And one of the important things that you need to understand is a scope of practice and modality requirement, which also varies by state. Depending on the state that you're in, the state medical board, who has oversight over physicians and their licenses in that specific state, may require an audio-video experience, meaning you have to be seeing someone, whether it be via a Skype, a FaceTime, or a secure telemedicine platform, while other states are now opening up telemedicine to just a simple telephone conversation. The other thing to focus on that also varies by state is whether a pre-existing established relationship with a patient is required in order for there to be reimbursement. And so you have to determine based on the state's executive order, and you have to determine based on the state medical board whether they are allowing only telemedicine to be used for existing patients when it comes to refills of prescriptions, or whether they're allowing telemedicine to be used to establish a new physician-patient relationship. As of today, I have tracked about 17 emergency orders, including emergency orders in some of the largest states where some of the largest franchisees participate, including Connecticut, Florida, Massachusetts, Texas, New Jersey, and North Carolina. And they have all passed some version of an executive order, and all of them are different. Some of them very specifically state what is and what is not allowed. As an example, the state of Massachusetts. Massachusetts has specifically said that telephone can be used as a means to communicate with patients and qualifies as telemedicine, has specifically said that insurance companies in the state of Massachusetts are absolutely required to reimburse and cover telemedicine services exactly the same way as if it were completed in person. And they are requiring insurance companies and providers to waive all co-pays and co-insurance for patients. Now, what that means for providers is providers are still going to be paid the exact same amount for the fee for service. It's just going to be covered by the commercial insurance company in the state of Massachusetts. Other states, as an example, like the state of Texas, have simply declared an emergency and given the Texas Medical Board and the Texas Department of Health the opportunity and demanded that they promulgate new rules to advocate telemedicine. And so you don't know, and we don't quite know yet, what the limitations and what the expectations are in Texas, which is why we need to track this on a daily basis and keep everyone updated with resources about what's going on in their specific state. And the reason why I bring that up is because I'm getting inundated with phone calls from people who are saying, I heard this such and such state, has waived all licensure requirements. Does that mean that doctors can practice in any state? I saw an article where Blue Cross Blue Shield Association says that they're going to reimburse and cover for telemedicine. Does that mean that all insurance companies are? You have to be very, very careful to interpret and take information, even information that's coming at the highest level of government, whether it be an announcement by President Trump or an announcement by Vice President Pence. You have to be very careful in interpreting something that is said at the federal or a state level and assuming that applies to different states and to different commercial payers. There are different levels of authority and jurisdiction, and unfortunately, when it comes to reimbursement and when it comes to licensure and scope of practice, it's a state-by-state issue. And so I want to make sure that I emphasize we have to be very careful about making assumptions on what's happening by reading the news. We need to trust very reliable sources on this information. I'll pause there, Derek, to see if any questions have come in via the webinar on that subject, and then I'm happy to move on to kind of how CMS and the federal government are handling this situation, as well as the Blue Cross Blue Shield Association and some others.
Justin, I'm glad you brought up the fact that these states are all different, and that it's difficult to try to take something that you might have learned from CMS and apply it against an insurance carrier if they don't have their own guidelines on it. I think, we have such a variance in states on this particular call. I think what I'm going to do is we're going to have a lot of these people that will reach out to us and want to communicate directly with you. So I will be able to provide your information to those people. We've engaged Justin, but those of you that want him to do their own little research projects or have their own questions, Justin's provided us a very good discount on his hourly rates. And hopefully we can work that out, Justin, so these individual business owners could also contact you when they have specific questions regarding their state laws. I also have a team that tries to research this stuff as well. So we don't want to reinvent the wheel as well. So we will get your access, your number out there, and so that you're available. Your expertise is available to our group, and that way we can approach this from a state by state modality. I think now, if you would address CMS, I think President Trump's direction to the sorry, I forget the lady that runs the CMS, as well as how insurance carriers seem to be falling in line. I think if you could address that, that would be wonderful.
Sure. So Secretary Azar is the Secretary of Health and Human Services, and Seema Verma leads CMS right now. CMS, for those on the line who don't know, is the Center for Medicare and Medicaid Services. It's a federally run agency, and it's a federally run program. So to the extent that you don't take Medicare or Medicaid, and my understanding is that most, if not all, the franchisees on the call do not. This doesn't necessarily apply, but the reason why it is important is because rules that are initiated at the CMS level are typically followed by commercial payers. And so on March 13th, when President Trump announced that the coronavirus pandemic was a national emergency, it gave CMS and the Department of Health and Human Services additional power and authority under Section 1135 of the Social Security Act to waive certain requirements regarding telemedicine. So essentially what they've done is they have removed what are known as originating site requirements. Typically, prior to the coronavirus pandemic, it was required that patients would be in a specific designated rural area and actually be in a federally qualified healthcare center in order to receive telemedicine services that were reimbursable by CMS. That has been completely eliminated for this pandemic. Now they are advocating and asking that patients stay home and leverage telemedicine services, and they are saying that they will reimburse. Additionally, they are also saying that licensure requirements will not be reviewed as part of the CMS reimbursement. So meaning if you are licensed in any state, the state of Florida as an example, and you provide services to a patient in another state that you are not licensed in, so long as you have a valid license, a valid medical license, you will be reimbursed by CMS. Now, again, to be clear, that's at the federal level. That does not apply to the individual states. The other piece that I want to cover, this is not necessarily at the CMS level, but I want to clarify one thing that Derek said earlier. He made a very, very good point. He said that the Drug Enforcement Administration, the DEA, has removed an in-person physical examination requirement so that you can actually prescribe, physicians can prescribe DEA scheduled 2 through 4 drugs to existing patients via telemedicine. But I want to clarify one thing that's very important and to be careful of, and that is that there are individual state-based DEA requirements on prescribing controlled substances that may be more informative and more stringent than the federal DEA. And so you have to be careful and you have to track those state-based requirements. Now, the other thing, again, that CMS is doing is they are waiving all copays and coinsurance for any telemedicine services. And so the reason why that is important is as I said, commercial insurance companies typically follow CMS and they heed the requests and recommendations of the federal government. So, both CMS and President Trump and Mike Pence and the White House task force are really emphasizing telemedicine as a tool that needs to be used to combat the spread of this virus. And so you're constantly seeing a number of commercial insurers, the Blue Cross Blue Shield Association and all 36 Blues plans recently announced that for all of their fully insured members, they were going to be waiving cost sharing and any copays for all their members, and they are going to be reimbursing for telehealth services. Now, it's unclear on what specific modality and requirements there are for that, but we'll get more information on that as they clarify what that policy is. Connecticut, some other localized health insurance plans in different states have also followed suit. They're waiving all of these co-insurance and cost-sharing requirements for their members, and they're advocating that they are going to ultimately reimburse providers for telemedicine services. So the key here is, again, just because one large commercial insurance company has said that they are going to do something doesn't mean that that applies to all commercial insurance companies, and it also doesn't say what the red tape is or what the specific fine print is. So we need to make sure as a franchisee and as a provider that we understand, even if they are going to reimburse for telemedicine services, what are the requirements for that reimbursement? Is there a specific coding modifier that is needed? Does it have to be via video, or can it be via telephone? All of these different pieces need to be understood and need to be addressed with the commercial insurance company or followed under the. But right now, I am happy to say that it seems like the commercial insurance companies are doing the right thing, and they're following the lead of CMS, and they're embracing telemedicine, and they're reimbursing telemedicine to help stop the spread of the virus.
Justin, when you say reimbursing telemedicine, are you suggesting that they might reimburse you the same way that as if you were in a face-to-face scenario?
Yes. Many of these commercial payers, and specifically using the example I gave before of the state of Massachusetts, they are requiring all payers in Massachusetts, and some commercial payers will come out and they will say that they are going to reimburse a video visit or a telephone visit, again, depending on the state and depending on what's passed in that state, at the exact same financial level as if that service were provided in person in a physician's office.
And that's Massachusetts. Unfortunately, there's a lot of other states that don't have great direction on this, so there is some risk associated with the reimbursement being different or coding being different. Correct?
Correct. That is correct. Massachusetts right now is the one state that I have seen that definitively and clearly says that they are going to have what's known as payment parity. There are other states that are requesting that commercial payers do that, but Massachusetts has mandated. It literally, a commercial payer or Blue Cross Blue Shield in Massachusetts or another insurance company in Massachusetts would technically be violating the law if they did not reimburse at the exact same level as an in-person visit. And I'm tracking this, on a daily and almost hourly basis for other states. And as the different states get updated, Derek, I will continue to send you the resources that I've been forwarding to you. And again, happy to send those to the franchisees. It's just important that we keep track of all of the different updates as states demand more social distancing. It's quite likely that we'll get more direction and ultimately get more assistance from, emergency orders that will mandate these types of payment parity.
Well, thank you, Justin. I do have a lot of questions coming up about your hourly rate and, things like that. We'll share with them offline once we set that up with you, when we have had a chance to discuss how people can access you after the phone call.
We're also going to answer some of the questions. We're also going to share with you some of the questions that are being asked during the question and answer period. So please stay on the line, Justin.
Yeah, so one of the reasons that I think we should go forward is there's a lot of tools and information that are going to now be provided that will answer some of these questions that we don't really need to have lawyers answering. You can actually see now some of the tools that are available and the information that's available in order to perform telemedicine appropriately.
Well, thank you, Derek. John will now update us on telemedicine and what actions our company is taking. John?
Thank you, Ed. Before I speak to telemedicine, I'd like to give you all a quick update on a couple of things that we've done here with regards to a couple of system changes. We currently have temporarily suspended any expirations of dormant patients for the Signature Patient website. So even our dormant patients will be able to get access to the Signature Patient website if they're not able to come into visits. We have also, for any clinics that are still selling packages, the cash clinics or the insurance clinics that are selling packages, we have stopped all expirations of those packages. So they will not expire. They will continue out, okay, so we will not be penalizing any of those patients that cannot come into any of your clinics. As far as telemedicine goes, as Justin and Derek alluded to, it's been an ever-evolving situation. So we began looking at telemedicine before the March 16th deadline that Derek was referring to, and we were out looking at many, many different platforms to find a HIPAA-compliant platform, one that was also very easy to implement, easy to use by both the provider and also your patient. We were also looking for one that would be cost effective. The one that we have chosen to recommend to you is DoxyMe. DoxyMe is a very easy to use platform. It is HIPAA compliant as long as you choose the $35 version per provider. It is a very easy platform. Inside that platform, there is a HIPAA tab that you can access to get your business associates agreement signed with them. It's kind of all filled out for you, and you can fill in some information and print it, and that's one way to become HIPAA compliant. But again, since we've been doing this, they have allowed those restrictions to be released, and you can now use your cell phone in some states. You can use Facebook or some of these other things. So this is just a recommendation that we are recommending to you. Through this platform, you can send invites by calendar, text message, and also by email. We have seen, because of the rush to telemedicine and the opening of all these restrictions, we are starting to see some degrade in service with text messages might be getting through, or some of the video as well in there. I think that these companies are going to continually expand their bandwidth, and their performance is going to improve over time. Inside this platform, you also have the ability to chat. So if you do lose the video while you're in one of these consultations, you still have the ability to chat with somebody. It can be used on iPhones, Android devices, and your home computers. Another thing that we like about it as well is you have the ability to share files with your patients. So you can send the survival guide. The patient can take a picture of their scale, for instance, and upload it to the system. They can also just turn the camera around as well, so you can see the scale as well. We have looked at some other platforms like Zoom and some other ones. The problems that we came up with those, Zoom does have a free platform. If you go to the HIPAA platform, it becomes cost prohibitive. But again, you can use the non-HIPAA approved platforms now. It's not very easy to use, because if your patient hasn't downloaded that Zoom plugin or the application, they're going to have to do that. So if your patients aren't very computer literate, they may have issues with that. As far as our system is concerned, the Advantage system, we added the 95 modifier, which is a telemedicine service rendered by a real-time interactive audio. Then again, that is the 95 modifier that must be attached to any services that you are providing by way of telemedicine. We have also added two other modifiers. One is the GQ modifier. It is the telemedicine delivered by an asynchronous telecommunication system. So if you're not using a real-time audio-video chat, you would need to use the GQ modifier. The other thing that we've added is the O2 place of service. The O2 place of service will automatically append to any claim that is submitted with either one of those two modifiers on the claim. We have already seen clinics in Illinois start to use the Doxy platform. We've seen the modifiers go up, and we've seen claims go out with those modifiers on them. We have not yet seen any reimbursements from any of those claims. We can maybe update you, hopefully next week with some of that. I would now like to turn it over to Stacy, where she can go over some other resources that we have created and continue to create to help you with this transition to telemedicine.
Thank you, John.
All right, thank you. Good afternoon, everyone. I think it goes without saying that everybody on the call certainly understands that the best treatment option for our patients, based on our medical research and the studies we have done, is in person. We also understand that it is the best treatment method as it relates to the business. But these are certainly unusual times. So we are pleased to introduce telemedicine as an extension of our service offerings, so we may continue to treat our patients and stay connected with our patients. The overall strategy or the implementation strategy of telemedicine in our own locations will vary based on the specific mandates in the carrier guidelines as outlined by the attorney previously on this call. So it is not necessarily a one-size-fits-all approach. We ourselves have to look at each individual region separately and identify what that strategy is and move forward with that. And as everybody's mentioned, in an ever-changing environment, so that be ready to change that strategy as we move along. So the use of telemedicine is new for us as well. We are not only navigating how we're going to implement the system and how to ensure the ultimate patient experience, but we're also assessing and looking at how we will be able to retract from the use of telemedicine when our country recovers from the current situation. So we have outlined educational resources that are aimed to assist your locations and ours. As we learn more from our locations and from all of you, we will continue to update the resources that we make available to the system. The first resource that will be added to Advantage is the telemedicine visit checklist. Included in that is a summary of the initial setup of the platform, preparing for that first patient visit, processing the encounter in the EMR, and the billing procedure similar to what John just spoke to, with the modifiers and which codes and how those are processed in the EMR. The second resource is designed more for our medical team, our medical providers, with guidance on medical documentation. Again, understanding that it is important for us all to understand that the codes that are covered by telehealth may vary by carrier, and it may be different than you were accustomed to before. So it does speak to that difference as well. E&M services still require certain elements inside the record. Your chief complaint, your HPI, your review of systems, your past family social history. Time qualifications for the codes are also important. So this resource speaks to some of those items to be able to help you navigate this and at the very least help point you in the direction on areas to more specifically research with your carriers or with your billing companies and your experts. As I mentioned, and I think a few of us have mentioned, we also speak to the value of the signature patient website, not only from the patient perspective, but from the medical provider perspective. To be able to have you in the exercises they've completed, to have you in the journal, the online journal. We do ask that you continue to share your experiences with us so we may collaborate and share all the information as it gets revised and gets updated across the board.
Thank you, Stacy. Let me share some things that we have done as a company and some of the things that our franchisees are doing to deal with this. As a company, we are organized to handle a drop in our revenue by taking the following steps. We've had a very difficult layoff. We have established major cuts in our expenses. We have met with the banks and have reset our credit lines. We are working in shifts to keep the amount of people here at a maximum, and we have reduced our rent. And here are a few things that you tell us you are doing. Some of you are telling your landlords that you are not paying rent during this pandemic. Others are asking for a rent reduction. Others are applying for the SBA low interest rate loan with 30-year amortization. I believe it's at $2 million. Reserve your place in line. Every day counts. They're going to take these loans based on the order that they're put in. Preserve your cash. Stay in touch with your patients. Through our task forces and your feedback, we will evaluate the status of our patient counts and outcomes and their effect on the franchise system. We're in this together. It will take all of us to get through this, but we're strong and we're a unified system. We will now answer your questions during the next 30 minutes, including some of the questions that are being asked from Justin. Derek, you had a point?
Well, I did have one question come in while I was talking that I'd like to address specifically, and it's about cash clinics. I know we spent a lot of time talking about reimbursements, but we should understand that cash clinics, telemedicine is even more desirable right now because if they don't have some of the limits that reimbursements would have when dealing with carrier guidelines, CMS, and everything else. So those of you that are at cash clinics, don't get confused by our crazy language regarding reimbursement issues and CMS issues and everything. You are more free than others to charge for your services and implement telemedicine accordingly. Again, the DEA loosening restrictions on Class 2 to Class 4 is wonderful news for cash clinics. Check your state laws again on the availability of telemedicine, and the tools that are out there no longer have to be HIPAA compliant during this pandemic. So I want to be 100% clear that cash clinics, telemedicine is a wonderful option that they should be reviewing as well as the insurance clinic.
Thank you, Derek. Randy, what is our first question?
Okay, the first question is, how can franchisees communicate and share thoughts, ideas, and best practices amongst themselves? I think that.
And Joe, I guess you're going to answer that one?
Yes, Ed. We're fortunate that we have a seasoned and experienced group of franchise consultants, Brett, Casey, and their regional franchise consultant team. You should utilize those consultants on a weekly basis to stay in contact and not only provide them with feedback on your location, but also gather information from them on this landscape and everything that's changing weekly. Second, I would encourage you to reach out to your National Advisory Council. We didn't mention, but we will now. We have a call weekly with the NHC. We've already had one this week, and we'll have one again on Monday, and that'll continue so we can gather information. So we encourage you to utilize the NHC. They're a valuable source of information, but they also need information from you on your insurance carriers and what you're hearing. Third, we encourage you to attend this weekly CEO communication webinar, and I think we've had tremendous attendance on this one, probably well over 90% of all locations. So those are your vehicles for communicating, and we encourage you to do it on a weekly basis.
Thank you, Joe. Randy, what's the next question, and who's it for?
Okay, the next question will be for Derek. Why are we keeping offices open in light of the CDC recommendations about social distancing?
That's a difficult question. We're not keeping offices open. These are independently owned and operated medical practices. Every state is treating this pandemic a little differently. Some states, there are strict stay in place type protocols that are available. You have to talk to people like Justin to determine whether or not that applies to you. But let me tell you, when we say stay open, I don't even like using that phrase, because the truth is telemedicine is staying open, and you don't have to see people face to face. So we've stopped using the terminology of closing, like closing a location, because I don't think that's the right way to describe this. What this is we're instituting telehealth protocol for your next 2 visits, or explaining it to the patient of why you might be seeing high-risk people through telemedicine and other people coming in the clinic while you have additional cleaning protocols. So I guess my answer to that is every state and every business owner is treating this a little different. We're the franchisor. We're providing you tools to allow you to make good decisions on your own. And we're trying to help you through this pandemic.
Thank you, Derek. Randy, what's the next question?
Great. For Dr. San Miguel, if we do keep seeing patients in the office and an employee tests positive, then what's the steps that we must follow for that?
So that's going to be, and it is already addressed in those contact protocols, the enhanced protocols that went on Advantage. The last part of those protocols is specifically that. Dr. Guzman made sure that we were researching the latest of the CDC recommendations. So those guidelines are going to be starting on page 7 of those enhanced protocols. It will go through if there has been any potential exposure or known exposure within either the patients or the staff, what needs to be done, and links to access accordingly.
Great. I have another question about the modified guidelines. Should we be wearing PPE while seeing patients in the location?
So PPE should always be worn. PPEs can differ in different scenarios. Those can include gloves, masks, or any type of equipment that are barriers. Right now, I do understand that they are in short supply of acquiring these things. So I believe, obviously, gloves is a PPE that we should be routinely wearing and utilizing per OSHA protocol. If the question is, should we be adding barriers because of the COVID, it really depends on what the exposure is and what role you provide to the specific location. So I think this is definitely something that needs to be determined by the medical director of each location, depending on the exposure, the specific exposure of that location and in the state that they are currently.
Great.
Thank you. Next one, Randy.
Okay, so there are a few questions about monthly fees. So will some portion of the franchise or system branding fee be waived? And I think that question should go over to John.
Thank you, Randy. Yes, we are currently working on a program. Those of you that have been around for quite a few years, you know that we came out with a franchise assistance program back in around 2009, 10, and 11. We are going to be instituting a plan like that as well. We're finalizing that this week. You will be able to submit into that to qualify for the franchise assistance program. I can tell you, when we look at the numbers, you know, clinics in different parts of the country are feeling this pandemic differently than others. So we have some in New York, for instance, that are getting hit very hard. We have some in the state of Georgia that, you know, aren't getting hit as hard, and some in Georgia that might be getting hit harder than others. So it just depends on the situation that you're in. We are going to be here for you to help you through this time, and we should be able to be publishing that program out shortly next week.
Certainly by the next town hall, we'll have something in your hands to look at. Randy, another question?
All right, the next question is for you, Ed.
Oh, great.
How far into the future is corporate planning, since it will be likely a few months before normalcy comes back?
We're planning well into the future. We're not planning anything other than action. We're battening down the hatches, and we're sailing through this storm, and we'll get through it, I'm sure, no matter how long it takes. The company is strong. Our banking is strong. We're going to do whatever we need to do to help everybody get through, and we're going to get through it again.
Great. All right, the next one is about what do you need from the franchisees to help the entire system? So Andrew, you ready to take that one?
Thanks, Randy. I think that's a great question because as Ed mentioned, we're all in together. He's mentioned what we're doing here internally to control our expenses and to maintain this. And obviously, Justin mentioned all that's happening and the regulations being significantly lessened with telemedicine. We're all in it together. Everyone needs to stay in touch with their patients as much as possible, which is we can greatly do through telemedicine now. As much as you touch points with the patients to maintain as much business as possible. You need to continue to stay in touch with us. We're going to continue to stay in touch with you and share ideas. We'll have these weekly calls. You'll be speaking daily with our franchise field consultants, and we'll all make this through together to come out stronger and better on the other end.
Next question, Randy?
Okay, the next question is about product and supplement delays. Do we expect any shortage in regards to our product orders?
That's a great question. We are currently having calls every single week with all of our vendors to find out whether or not there is any potential issues that they may be having. But as you can imagine, this is a ever-evolving situation, just like everything else. As of today, we have not heard from any vendor that there is any potential supply interruption. We here at the corporate office have taken some precautionary steps. We're bringing in a couple of months worth of our online sales to this building here in case one of our vendors does have a shutdown. The only thing that we have seen so far is a slowdown in some of the deliveries from FedEx and UPS and things of that nature. But at this point, we have there's been no communication to us that there's any issues with any of our supply chain.
As a matter of fact, we're actually also keeping our vendors current with their bills so that we don't harm the supply chain because we slow pay somebody. So my anticipation is that we'll have the supplies necessary as long as the vendors stay open to accommodate any of our clinics.
Yes, and I should say one other thing. We also have put in additional purchase orders to our manufacturers to bulk up their storage facilities in case they are not able to have their lines up and running, but they do have their shipping department in to us. So we have also done that as well.
Randy, next question. Are there any questions for Justin?
Justin's had to take a 3 o'clock call.
Okay.
Yeah.
Is it short too?
I'm sorry. I don't know what time zone it's in.
There's a question for Dr. San Miguel about updating a resource to address emotional eating or anxiety depression during this time.
Yeah, so I recommend that we continue to use our resources that are already available. We do already have resources available for emotional eating. Basically, it's just a change of scenario for these patients. So it's important to recognize that this is like any other stressor that patients can experience and resort to emotional eating. So don't forget that this is, it is a very new and different experience, but still a stressor. So just continue to educate your patients like you would on handling any other stressor.
Great. We have a few questions about just like the status of different locations. Ed, has any location temporarily closed?
Yes, we have had a couple of temporary closures due to the state regulations. We've had, I think, one closure because of just the time. I mean, it's difficult, but so far it's been minimal. I do anticipate, though, that there will be other closures. Closures have to be done through Derek's office. Hopefully they're just time closures, and within a month or two they'll be opening up, and we'll be ready to get them up and started quick. It's important to keep in touch with your patients. this email we're sending out on Tuesday is going to highlight the fact that most of the clinics can use telemedicine now, so that should help them. But at this point, I think closures are minimal.
And then I think there has to be a change in our vocabulary for a true ceasing of operations, which is minimal at best, versus, a telehealth situation where you don't have patients actually physically coming in to the office. So different concepts. We've had cease in operations, just a minimal one, actually two that we help with patient contacts. We have emails and letters to help in those scenarios. So reach out to us so we can help you through that through your FTC. But the other types of closures aren't really closures. We do have franchises that are now going on a telehealth protocol where they're trying hard to get all their patients' continuance of care done through the telehealth mode.
In a corporate-owned units, the process that we're following is that we're gearing up for telemedicine, but we're still seeing patients when we can see patients, and we're slowly learning and transitioning as much as we can to telemedicine to protect the health of our patients. Any other more questions?
There is a question, I think it was addressed partially, or if not fully, but probably for John. How will the corporate office support the location if Tampa faces some sort of shutdown?
Well, that's a great question. So what we have done here is we have initiated our protocols here. We are currently have staff working from home, and we're rotating that staff to try and minimize any potential exposures here in the building. We are working through any glitches. That's why we are doing a rotation right now, trying to figure out any potential glitches we have with potential communication between our corporate staff. If we are going to go where we have to work from home, we expect it to be a seamless thing. You would not notice that we are actually working from our homes, other than you might have all of our personal cell phones or something. But we all have access from our homes to our computers and all to our network that's here in the office. So we anticipate very little to no disruption from the corporate office's standpoint.
Yeah. I want to say, because there's a lot of questions coming in regarding Justin. We have engaged Justin, and I have repurposed our compliance department and other individuals that basically have taken their departments have taken a back seat, and we're getting on telemedicine. So when I say you have access to Justin, that doesn't mean that I'm not going to have additional support for you and information regarding your local, laws. We have taken our compliance lady, made her full-time researching telemedicine laws in states. Justin, I have hired so that he can try to keep us up to date on these emergency orders. Just had one come in on Connecticut, where they're allowing telemedicine in Connecticut. That just happened recently. So these things, again, are fluid. We are spending money with Justin ourselves. We are also repurposing some of our legal department to only study telemedicine right now during these times. You're not going to get a compliance visit, obviously. And if you had one recently, you're not going to see a written one go out. That lady can no longer do compliance. She's all telemedicine. So I hope that answers some of your calls or questions regarding, Justin, and do I have to pay him? And, there's going to be things you need to research, especially with your own carriers if you're taking insurance. But we're trying to get as many answers as we can. You might be a little frustrated with me because telemedicine law is a little bit of a chaotic thing. Not every state has anything written on it. And if it's done recently, it will be an emergency order. And you might see that order before I do. That's why we hired Justin. But
okay, I'm going to open this up to Curtis Friday, who is the chairman of the NAC. I know Curtis is, in the last 3 days or so, has been starting telemedicine. Randy, will you open it up, please, for Curtis? Curtis?
Are you on?
Yeah, I'm here.
Curtis?
Can you guys hear me?
Yes, we can. We hear you loud and clear.
Good deal.
Curtis, can you give the field an update on how you're doing with your transition over to telemedicine?
Yeah, we've learned a lot over the last couple of days. It's wild times, definitely, but we have transitioned to telehealth. We are using the DoxyMe in both our clinics in Illinois. Our governor just actually, as I was on this call, just made a statewide lockdown. So previously we were bars, restaurants, all public places closed, and essentially most people weren't coming out. Now it's rules to not be. So telehealth is crucial for us. I'd say patients love it. They're kind of laughing at it. But I think it really gives us a chance to connect with patients. And, first couple days, it's obviously we're not doing as much in sales as we were when, we were wide open to seeing patients in person. But we are holding some people on the schedule. I think we'll get a little bit more aggressive in our messaging and marketing that. We just kind of wanted to spend a few days figuring out the operations of it. It works pretty well. We have two computers, so one computer that we're doing the DoxyMe on and the other computer with the EMR open right next to each other. And so that's kind of been our approach. But so far, so good. Take it in stride, and I really think that patients will take to this. And I think we have an opportunity here. We just, you got to kind of walk before you run. But my recommendation is do not wait around for corporate to invent the wheel because the wheel doesn't exist yet. We all just got to kind of try it out and learn from what's out there is my recommendation. So if you're in states that are, already having these tough times like we are in Illinois. So I've been very happy with DoxyMe. We did have a little issue with the website today. It wasn't allowing us to text patients the link. So, I do have a little bit of concerns that whether it's DoxyMe or any of these sites, they're going to get inundated with providers across the country. And I'm a little worried about their bandwidth, but it makes me feel better now that the carriers are loosening the language and, we can use any medium we really want. So I think my one point would be whether you use DoxyMe or something else, start trying it and start using something. Yeah. Is there anything I didn't go over, John, that you wanted me to go over?
No, I just wanted you to give an update on how your transition was, because I know, you're on the front lines and, we're here. So I think it's good for people to hear about yours.
I'd say to any franchisee on the call, be bold and be strong with it and encourage your staff, because our staff did a great job on being nimble and quick and making a big change in direction. And our patients seem to be loving it. We're getting more and more calls, and we'll see. I mean, we're making progress, so we're excited.
Look forward to an update from you on next Wednesday's call, if it's okay with you.
Absolutely.
Okay. Any more questions, Randy?
There's two quick questions that just came in that I think are important to address. One is just to clarify, I think, John, you may have mentioned that there was one location that scheduled 200 telehealth visits for next week.
I mentioned that.
Okay, Ed, you mentioned that. So they were asking how to do that. And basically, you're still using the EMR, correct? You're just calling and telling them your visit will be conducted via telehealth now and getting them prepared for that experience. Is that right?
Randy, it's Dr. Senegal. It does send a link to the patient. Once you invite the patient for their appointment, it will send a link to the patient via email or text, whichever you choose. And then the patient just simply has to press on that link, and he or she will be directly connected to the telehealth visit and will appear in what they call their waiting room.
I actually think that was also done partially by phone.
Yes.
All by phone.
Yes.
Yeah.
The clinic in Massachusetts did it all by phone, where they reached out to their acute visits coming up from next week by phone to let them know that their visits now will be being done by telemedicine. I'm not sure if they plan to use the DoxyMe platform or they're just going to use their phones to call these patients or not. but they have now, because of state mandates, they have taken the opinion that they need to start doing telehealth only.
I am getting some questions regarding a new patient versus a follow-up patient, and the clinical aspects. And maybe Gretchen can give a little bit of insight. But again, I can imagine that the concern might be, are we putting a new patient, if you can believe getting new patients during this time period, which has actually happened. We have clinics getting new patients.
We have an enormous amount of leads still coming in.
Yes. So, Gretchen, handling through telehealth a new patient visit, controlled substance type issues is probably going to be the main concern, because you can't do some of the blood panels, EKGs, things that you would necessarily do, versus a follow-up patient where you have records of this stuff.
Yes. So I think the prescription issue will be your major hurdle of taking on those new patients, but don't just assume that you can't take new patients. You can still consider taking new patients. Please, again, get in touch with your medical director to see what his or her guidelines are going to be and what your state guidelines are. But there is no contraindication to our program that you can't do over telemedicine as long as you're not doing the prescription appetite suppressants or any type of appetite suppressant. A lot of times, most of the information that you will need to know in order for them to be able to be on the program, you should be able to acquire that through a telehealth visit. Again, these are just mere guidance and recommendations from our end. Please make sure that you talk to your own medical director and make sure you're reading your state guidelines to make sure that this is possible in your area. But from a mere clinical aspect, just remember that there's not a lot of contraindications to going on the program. More of the hurdles are going to be with being able to acquire enough information necessary to responsibly prescribe an appetite suppressant.
And that would be for the first visit. On the follow-ups, you guys have a lot of information already regarding the patient's medical history, the previous EKGs, blood panels, and you will have additional protocols in place that we'll have out to you next week regarding ways to check their weight, their BMI, potentially even blood pressure, things like that.
Yes, and then one of the questions that we had is, what about restarts? So I think we can be a little bit more lax with restarts and take a look, since we do have previous information from those patients, like previous EKGs and we already have a complete history. So I think we can update a lot of those histories over the phone, make sure they haven't had any recent heart issues or hospitalizations or new medications. All that can be updated through telehealth. And then again, it should be seen by the provider case by case to what the risk would be to be able to accept a restart like that without any additional evaluation.
As individual owners of your own businesses, it's going to vary all over the states, and it's going to vary even in the states. I know, for instance, in Massachusetts, John mentioned one of the clinics was going to do just telemedicine, but on the other hand, we know a couple of other clinics that are still seeing patients and using a combination of telemedicine and face-to-face with the healthy patients using the proper protocols. Randy, do you have any more questions?
I have one statement that I wanted to read that came through that I thought was very important. And it's really talking about, we know a lot of our patients may struggle with other health conditions and comorbidities. So I'm just going to read exactly what this franchisee wrote, and I think it's so important. Basically, staying open and offering telehealth is so important because we may be the only connection to a medical professional for many Americans. Helping to keep our patients on track will help keep them well. We need to keep our patients well. MEDI weight loss isn't just about weight loss, it's truly about wellness.
Hooray for whoever said that. That was fabulous. Later, tell me who said that,
Okay.
please. Well, thank you so much. We're now into our second hour, and we're going to call it a day. If your question wasn't answered today, I assure you that it will be answered next Wednesday. If you have additional questions, please keep submitting them. We will also answer some of the questions that you've asked about from Justin, after we talk with Justin. Justin's a specialist. I recommend using him. A lot of you have asked whether or not he will have a discount. I can tell you that yesterday I personally negotiated with him, and I would advise you to do the same after he talks to you. But there is a level he won't go below. He's a New York attorney, very, very busy and very highly specialized, like this Dr. Guzman or Dr. Gretchen. They're really at the top of their game. He's really at the top of his game. Again, stay healthy. We'll get through this together. Thank you all.
So a recap MEDI news post will go up along with a recording of this webinar, and we'll talk to you again next Wednesday.
Next Wednesday in the NAC on Monday. Thank you very much. Stay healthy.